Hey, thank you everyone for your patience. Hello again, I am Councilwoman Dr. Niyah Glover. Tonight's presentation, we're focusing on stressing less, right? Practical strategies for managing life pressures. Along on the call tonight, we have one of our board members, Ms. Tracy Ricks. She'll come in later in the presentation to provide you all with some resources that we have embedded here as well. We wanted to make sure that we got this recording for you all so that we can place on the city's Facebook page, as well as websites, as well as the mental health hub. So hopefully you all are kind of navigating those three locations so that you all can actually have access to those resources that we will talk about tonight. So again, welcome again to our webinar focusing on stress management. We're going to talk a little bit about some key points to ensure that you are prepared, understanding how to recognize stress before it becomes overwhelming. Learn and practice healthier coping strategies that can protect mental health as well as your physical health. Hence the mental health walk, that collaboration, that mind-body dynamics that is important to maintaining and sustaining mental health, and exploring those resources towards the end. We're going to identify different levels of stress and different areas of stress, and those resources are used to help link you to those areas so that you can ensure that you are reaching your optimum health. And again, if you have any questions, please let me know. So the first key point of understanding stress is being able to define it and understanding the differences between the short term as well as the long term. So the definition, the textbook definition of stress is that stress is the body, physical and emotional and mental response to any challenges or demands. We will hike in that area, impacting different areas of our body. So looking at that normal stress, that short-term day-to-day stress that we have on a daily basis, it helps us focus though. So it's all about how you perceive stress. It helps us focus, meet challenges, and stay alert. So we want to heighten our perception so that we can build the emotional resilience. So stress affects us in all walks of life. Again, our work, our home, and our relationships as well. So again, today we're going to focus on understanding our stressors, whether it be short-term or the long-term impacts, and how we can better support you here as a city, right? So the chronic stress is showing to wear down the physical body and the collaboration with the mind. So this can lead to serious health issues such as heart disease, anxiety, depression, as well as lower our immune system, making us more susceptible to things such as common colds and things of that nature. So again, empowering ourselves and understanding and recognizing the signs of stress plays a vital role. Right. So here are three categories that we're going to look at and again, align you with those resources. Right. So understanding our stressors, stress isn't, again, always perceived as bad. So in small doses, it can help us to meet our deadlines or even stay alert in everyday life. But chronic unrelieved stress are the ones that we actually focus on when we are working with our clients in the mental health realm. And how is it affecting us physically as well as emotionally? So understanding these differences are the first step to ensuring that we're maintaining. So looking at the physical, stress will show up physically in the body, right? So you may have the frequent headaches, stomach issue, gastro issues may come about. You may have some sleep insomnia, chest pains, and all of these are certain signs, if not medically induced, but signs that stress may be impacting you. Emotional signs, we may see mood swings, some irritability, inability to just calm yourself, and feeling overwhelmed or even helpless. Behavioral signs would be those typical activities that you enjoy doing, but now you're seeing that change where you're not doing or acting the same way. You're withdrawing from family, friends, those social activities that you absolutely used to enjoy, but just not doing them anymore. Procrastination, increase in substance use as a coping mechanism as well. So some common triggers, again, highlighting workplace stressors, financial stressors, relationship stressors, health and wellness stressors as well, and then just life transition from different developmental periods as well. And on the Mental Health Hub, we focus on ensuring that we are streamlining those resources on a developmental period, right? So here, recognizing those signs, these signs can show up in different ways in different people. Everyone cope differently. We learn throughout our lives how to cope in different manners. But in some cases, as we develop over time, we may need to update and adopt new ways of coping. So those physical symptoms that were highlighted, behavioral and emotional that we previously highlighted, we want to encourage you to kind of do a check-in on yourself every day and see how you are doing. How are you feeling? And where are these stressors and where do they actually lie? Are they due to workplace deadlines, high workload, difficulties in the workplace with coworkers or supervisors, financial stressors such as debt, bills, unexpected expenses, and we're going to align you with some resources if you're facing challenges there too. Relationship stressors, conflicts with family, friends, or partners. Health and wellness stressors, so illnesses, injuries, caregiver responsibilities are heightened today in today's times as well. And then again, those life transitions, kind of moving from job to job, or starting or ending relationships, or just becoming a caregiver. We have now within this generation have coined the generation of the sandwich dynamics, where we have middle-aged individuals are taking care of their children as well as their parents. So that can induce a little bit more stress there as well. So how do we mitigate those stressors, and where do we reach out to get those resources? So that's vital to ensuring sustaining those stressors, right? So some common stress triggers before we go into those early recognition. This is a model here that we utilize in counseling. Some of these stressors that we've talked about can build up over time. And you're going to see here, starting from thriving to crises, over time, these stressors kind of take us through these different variations. So early prevention is important to ensure that we are staying within that thriving, that optimum functioning in our actual life. So early awareness, prevention, it prevents this escalation from actually taking place. When you know what specifically causes your actual stress, you can kind of catch it early and stay within this thriving area and prevent anxiety, depression, and those health problems that are subsequently to happen. You can respond as well in a more proactive way instead of reacting. So early awareness and being able to understand your stresses and the categories that they fall in help to ensure that you are responding instead of reacting to the actual stressor that is posing that threat. So that you can also better choose a healthy response, right? How do we actually prevent ourselves from going from this optimum level to this hopeless level or this crisis era on this actual early prevention recognition model? Also, early awareness helps you to, tailor those coping strategies that are needed for your particular stressor. So again, everyone copes differently. Understanding yourself and the coping mechanisms that you learned throughout your life and whether they're still working. Are they vital for today you versus 5 years you? Right? So we need to possibly update those so that we can build better emotional resilience and recognizing patterns that strengthen us and strengthen our self-awareness. The more you understand your cycle, your stress cycle, the more resilient and adaptable that you will actually be over time. So you want to look at this particular model to ensure that you are aligning yourself with some understanding of how you derive to a crisis mindset, right? This understanding or this knowledge will ensure that you improve your overall well-being, right? So the key to the early model here, this early prevention model, or the thriving to crisis image that you're seeing here, is to ensure that your progression does not, of course, increase to that crisis area. So again, the striving area is where it's a little bit more milder of its cases, and it goes sometimes unnoticed, right? We just kind of brush it off and we just feel like that's just a normal life. We kind of become conditioned in this particular striving area. We become conditioned to this is the way of life, and we kind of brush it off. That's how we transition into that struggling and crisis area. We condition ourselves to stay in that fight flight mindset, right? So understanding again this early recognition, it preserves well-being as well as your motivation. Catching stress early will allow a person to stay in the thriving zone. Right? And again, that's the overall goal here, to ensure that we improve our optimum function, improve in adaptive skills, so that we can ensure that we are sustaining our well-being and our motivation, right? So it also allows for you to respond, to cope and find the support that you actually need if you're staying within that thrive component here. Also, moving forward, looking at some importance of early recognition, it protects you in that long-term value too, ensuring your mental health. Early action reduces the risk of chronic illnesses, as we previously highlighted, and ensuring that you are implementing the emotional regulation techniques that are vital to sustaining yourself. And Ms. Ricks, do you have anything that you would like to add on this particular model here?
No, everything is well understood because of the fact that it's plainly outlined, just encouraging everyone if they need the help, don't be afraid to reach out.
Absolutely. Thank you so much, Ms. Ricks. So the benefits again of early recognition reduces physical wear and tear on our bodies, helps maintain mental clarity and emotional balance, prevents unhealthy coping mechanisms, and also builds self-awareness. The goal and the key is to understand who you are independently of that actual stressor, right? So doing those daily check-ins to ensure that that stress or that situation is understandably situational, that if you look at it as a situation, then we can navigate out of it, and it does not have to become the total you of that situation, right? So we want to ensure that we are perceiving things in a different manner as all over, right? We typically have clients that once they are invited with something that is so overwhelming, it starts to change and shape how they respond, but how they view themselves as well. So you are independent of your actual stressor. That is not a part of you. We can find resources to actually eliminate and mitigate those different types of stressors. So healthier coping strategies, kind of giving you the understanding, just a small snippet of different coping strategies, which are methods that we use to deal with stress. Some that we focus on in therapy would be emotion focused therapy and problem focused therapy. So the emotional focused therapy helps you regulate emotions, your emotional responses to the actual stressor. So we want to align you with those different techniques as well in this presentation. And then the problem focus approach is to directly address those different stressors, right? So we do see more benefit when this approach is collaborating within our therapeutic model. So we implement both when we're working with our clients, and we see a better outcome when we implement both of these. So as you kind of take some of this information in, please try to implement these both of them on your day-to-day, right? So certain things that we talk about and things that you may see out at the mental health walk. If you come out, you're going to see this combination. A lot of the therapists out there and vendors out there are going to talk to you about these different aspects as well, and how they play a vital role in sustaining you over a period of time. So looking specifically at emotion focus coping. These strategies help again to regulate emotions when we can't immediately change the situation. Techniques like deep breathing that you see on here, mindfulness helps to reset our nervous system to, again, help prevent from lowering the immune system and inducing any health outcomes or negative health outcomes. Talking to someone, we always encourage you to seek therapy or talk to someone, family, friends, trusted family and friends that you want to seek advice from. But if you don't have those outlets there, journaling is always a great thing to do, right? To actually get those things out. The most important thing that we express to our clients is to get it out immediately. Writing out your worries and solutions will actually help process the emotions more constructively so that you are, responding, as I previously highlighted, instead of reacting. So looking at these different types of things, there's a lot of great apps, especially for mindfulness and meditation. I absolutely love like the Calm app and things of that nature. So looking into some great tools to help there will be very, very important. We're going to definitely align you more with things that are going to immediately help for resources within your city, but you still need the emotional aspect to sustain you while stressors are actually at play. So the problem focus, so for example, if we're looking at your work, a school, and just a whole combination of things that you have going on in your life, time management may be, that approach to kind of help you mitigate those stressors, right? So breaking tasks down into manageable steps or processes, prioritizing urgent versus important, having a master plan or a master calendar, or even a day-to-day list so that you're not feeling overwhelmed on a daily basis to accomplish everything in that one swoop. And things that are least of urgency or importance can transition to the next day. So ensuring that you have some type of management skills help with coping when there's a lot on your plate. But for me, what I see, and I don't know if Ms. Ritz can speak to this as well, but boundary setting. Boundaries are some of the most important things that I see that stresses my clients when I'm working with them, that they don't know how to set boundaries or even just simple word no, right? So saying no when needed sometimes is important to protecting you emotionally and physically, just your personal time, having that time to kind of get out and explore things that you like when you're kind of putting more into everyone else or just everyday living. We start to neglect ourselves. So boundary setting, I think, is one of the most important things that I have to work on with my clients. Would you agree, Ms. Ritz?
Yes, and I always share with my clients that no is also a complete sentence. We don't always have to try to validate or explain where we're coming from. Just know that no can be a complete sentence.
Awesome. I love that, actually. I'm gonna have to use that. Yes, I really love that. But seeking information, staying away from assumption. We look at, again, I talked about this in our first live session coming into the new year, looking at cognitive distortions, unhealthy thinking patterns are based off of assumptions. So you want to look into things that are more concrete to help ensure that you are not overthinking the process, which causes some of the problems as well as the emotional tolls that takes on our actual clients. So looking for, more solutions to reduce the uncertainties and fears. When we look at anxiety and depression, we are looking at anxiety is more linked to the unknown. Right. So that's why we want to align you with those resources. So you are in the know. You're knowing what is going on in your community and who is out there to assist you. Depression is more linked to the past, unresolved challenges. So you're kind of still looking behind you at some things that are not resolved. So how do we go back and kind of resolve some of those things? And it could be from different areas of your life, right? That's when seeking help or going to a therapist or something of that nature will be very beneficial, right? So also delegating tasks will be vital too, especially if you're taking on a lot of stressors as well. Time management, like we just talked about, setting boundaries, asking for help, all are tools under the problem focus coping strategy to help reduce your overall load. So when we take action like this and looking at those two components, looking if it's a short-term stressor or a long-term stressor, partnering it with understanding of the emotional component or the problem component, then aligning with some resources, that's how you start to lower those stressors, in your life. Today, you're hearing more and more stressors that are going on in practices across throughout. I don't know if Ms. Ritz could speak to this as well, but I am seeing a heighten of anxiety more so than anything because of the uncertainty of future aspects, finances, and things of that nature, right? So are you seeing this as well, Ms. Ritz?
Yes, yes, it's at a very high rate right now.
Okay. So when we kind of take action, it helps you to feel a little bit more in control, even if the stressor is a actual big component of your life, right? So making sure that we are taking a more concrete approach and less emotional approach will actually help as well. So some other stressors, some other effective coping for your stressors would be readying your body physically. To me, this is one of the best ones. I absolutely myself, I love
Mhm.
going out to the park. Miss Ritz, she's a walker. You may see her around Fayetteville. I see her often. So getting out there, getting physical is very, very important. Hence, again, I'm going to keep saying the mental health walk is on May 3rd, this Saturday. Readying yourself physically helps your body to release those feel-good hormones, those endorphins, and reduce stress hormones like cortisol, right? So getting out there and again, getting physical is always great. Balancing your diet, nutritional support, great food, partnering that component as well helps build the brain, supports the brain, and also build body resistance. Engaging in your hobbies, getting creative, relaxation techniques, relaxing hobbies are all great stress. So gratitude practices instead of focusing so heavily on those things that are problematic, if we shift our brain and retrain our brain to look at things more in a positive way, then every time we're presented, again, it's all about restructuring and reframing how we view things. If we start reconditioning our brains to look at things that are more positive, as soon as we're presented with a stressor, our brain is going to seek out the positive of that stressor. But if you conditioned your brain to look at things in a more negative component, your brain is going to automatically seek negativity. If you're thinking right now, if you're just questioning yourself right now, that's exactly what I do. You want to start on this gratitude journey. Start focusing on those great things that you are doing in your life, and then look for the resources that may be challenging your life. Separate the two. Again, not an all or nothing. That's a part of the unhealthy coping strategies, the all or nothing thought process. So looking at things independently of themselves so the stressors do not become who you are, right? So self-care matters, right? So movement and things of that nature are vital. So it's important to find your fun. Find the things that makes you happy, the things that you enjoy. Like I said, I'm a hiker. I tried fishing. I'm working on it. I wasn't successful, but guess what? It was something new, enjoyable. So yes, try new things as well. Diversify your fun. Is nothing wrong with that. Try new things. So maybe one day I may try camping, but again, getting out there, readying your body physically is vital to the entire process. So building a personal stress management plan reinforces these things. Again, understanding your stress and your coping cycle helps to make you a little bit more self-aware. And the more you do this, you're reconditioning yourself. You're reconditioning yourself to be a more positive outlook individual than more of the unhealthy thought processes, right? So looking at this plan here. I'll speak more into step 3 to kind of help you all with the actual toolkit that you can start utilizing. But step 1 is identify personal triggers, as we talked about. And how do we do that? When I first meet a client, we do a dysfunctional thought log that first week. And the reason why I have them journal any challenges that they may have for their first week is because I am able to see, one, how they think, how they navigated through it in real time for them to actually journal and get it out. But I can also track their high peak time. Maybe it's a Wednesday, because on Wednesday it's a little bit more challenging at work. If they actually know when their high peak time for stress in their stressor, right? If it's work, home, relationship, whenever that high peak time is, what can we do? We can actually tailor our approach, our coping cycle to it. We get ahead of it, right? So it's important to identify where and when that cycle actually starts for you. Step 2, select again that coping strategy that fits your lifestyle, your values, and tailor it to your actual life. Step 3 is to build a stress toolkit, techniques you can use daily or in crisis moments. Step 4, this is where the adaptability come in. The more and more you start conditioning yourself, you're becoming more adaptable and adjusting to actually things, because you may need to pivot. Those approaches that you implement may not be vital for that particular stressor. So you may need to pivot and adjust your actual plan here. So review and adjust as life changes. Your stress management plan should too. Not one stress approach will fit all stressors, right? So number 5, normalize seeking professional help. Mental health is help. So looking into finding those individuals that are in your community that are willing to help and want to be there, please take heed into those actual things. So looking into just building an actual plan, you want to identify or prioritize those first 2 or 3 that you would see are really crucial to you, right? That you would need to ensure that if you minimize those 3, then life will be just a little bit more tolerable for you, right? So also looking into tools such as quick calm tools, as I highlighted before, to help with immediate stressors, implementing something on a daily basis. I always tell my clients, have some type of calm down during the evening time is great. If you're not one that would like to exercise at night, but you should have a calm down so your brain can pull back from the day's work. So if you're one that likes to stay on your phone late at night and then immediately want to go to sleep, you may find yourself a little restless throughout the night because your brain is still actually actively engaging whatever material or content that you actually engage, and your brain is still cycling, is not able to shut off. Right. And sleep is our natural way of rejuvenation. So you're affecting that process, that natural process to take place that plays the most crucial role in lowering our stressors. Also, just that daily self-care, so the prevention stress management, the 30-minute walks, you can do that 4 to 5 times a week. If you need to get out or stay in, stretching, yoga are some great things as well. Ensuring that you're eating properly, like we highlighted, kind of feeding your body the healthier snacks versus the unhealthy, and hydrating yourself and things of that nature, right? And I highlighted scheduling that unplug time. We're seeing more stressors and more, I would say, when individuals are not able to cope a little bit better, we're seeing a heighten when it comes to regular content, negative content that they are digesting on a daily basis, right? So you want to kind of unplug sometimes, give yourself a internet break. Sometimes it will actually be great. And again, I'm always go back to that gratitude journal, giving yourself some of those praises instead of kind of the negative thoughts. Praise yourself for the things that you did accomplish on a daily basis. So those affirmations and things of that nature, and tapping into some more of those emotional support tools, family, friends, again, the positive affirmation, journal prompts, all of those are great things to help in this cycle and in the cycle of actually going to release, but reconditioning your brain to help for the bigger picture, eliminate stressors and how you actually cycle through them. Another one that I actually like would be the personal mantra. When you're feeling yourself overwhelmed, having that personal mantra, such as one step at a time, or we can do this, or I can do this. Having that mantra is a great tool to help with emotion regulation, especially in immediate heightened emotional challenges. Ms. Ritz, do you have anything to add on here?
No, I totally agree with everything that you're sharing with us. It's so vital that, first of all, that we have that self-awareness, that
Mm-hmm.
I'm aware. I love how you shared that with us about the fact that, you know, there's triggers, like what time of the day is it when the kids are coming home from school, or
Absolutely.
maybe what day of the week, payday, I
Mm-hmm.
mean, what day is your stress day, or what time? And so once we become aware, then we can be intentional about having our stress toolkit ready and on hand. So thank you. It was such great information.
Awesome. Thank you so much. So we're going to transition. Ms. Ritz is going to go over some resources here. To me, this is the most important. You need to know what's going on in your community. Where can you get the tips? Where can you get the support? And who's out here to help you? So it's about you, right? So knowing where to turn when stress is too much is the game changer, right? So knowing those resources, I often get communication on where do I get this support in my community, locally or even nationally. Tap into these different types of things. And if you find support, share them with your family and friends. We are all in this community together. So we have to ensure that we're helping each other, right? So share what you learned so that we can build a community together of course, mental well-being, but just collaboration and working together. So Ms. Ritz, I'll transition and let you take us away with the different resources that are within Fayetteville and within Fayette County.
Thank you.
You're
And
welcome.
good evening, everybody. But I would also like to share with you all that seeking help is not a sign of weakness, as some of us have been taught, but it's actually a sign of strength.
Mhm.
So here's stress management and some mental health resources that we have available. Through the city of Fayetteville, our mental health hub provides tools and resources to support mental health and well-being. Of course, you see our website right there. We have a plethora of information. Also, our Behavioral Health Associates of Georgia. They offer individual counseling, family therapy, and stress management services. Also, we have listed their website. And then Fayette County Counseling Center provides mental health outpatient services, including individual counseling and case management. Then we have the Fayette Care Clinic, which offers free mental health services. And notice I said free to uninsured residents of Fayette County. So there's no excuses for saying I can't afford it. Also, Georgia Crisis and Access Line, which is 24/7 crisis support. Call 1-800-715-4225. And also we have their website available. For financial assistance, we have Fayette Factor, which provides emergency financial services, including rent, mortgage, and utility assistance. Notice a lot of times when we don't have what we feel like the necessary resources for our bills, that can cause a lot of stress. So reach out if you need help with that. Also, we have Georgia Rental Assistance Program, which offers up to 18 months of payment relief for eligible applicants. Also, we have their website right there listed so you can go directly to it. Also, St. Vincent de Paul, Georgia, assists with financial aid. Contact their assistant line at 678-892-6163. Also, their website is listed. And then dial 211. I was going to say 911, but I guess, hey, we're so used to 911. So add a 211, which connects you to local financial assistance programs, including help with rent, utilities, and more. And their website is also listed. And then for food assistance, we have Fayette Samaritans, which provides food, clothing, and emergency financial assistance. Their website is listed. Also, we have Real Life Center, offering a mobile food pantry and other support services. Their website is listed. Also, Georgia SNAP program. which assists low-income households with monthly benefits to purchase food. And then also we have Finding Help, and you have their website listed, www.findhelp.org. Then we have educational support. You know, we learned earlier that sometimes it's just a matter of gathering the right information. Sometimes we're stressed out because we don't have clarity. So if you need educational support, reach out to Fayette County Public Schools, which they provide special education services and resources for students with disabilities. Their website is listed. Also, Joseph Sam School. They offer programs for children with special needs, including speech and occupational therapy. Their website is also listed. And then AV Pride, After School Enrichment Program, which provides K-5 students with academic support and enrichment activities. And their website is also provided. Now, for housing support, you know, if you're stressing out about housing, Fayette Factors Operation Help is available. They assist families with housing and utility payments to prevent homelessness. Also, we have Georgia Housing Choice Voucher Program, which provides rental assistance to low-income families, the elderly, and the disabled. Their website is also listed. And then we have Low-Income Home Energy Assistance Program, which helps low-income households with their home energy bills. And if you're like me, I know a high energy bill can kind of take your stress level up real high. So these are some of the resources that we have available. Now, the importance of resources. Quick access to help. It reduces delays when support is needed. Builds confidence and control. Knowing where to turn eases fear and uncertainty. Also strengthens connections. Prevents isolation and provide practical solutions. Remember, isolation is not great. It's not a great idea when you're going through something that's very stressful. So also addresses root causes. It helps to manage financial, housing, food, and health stressors. So remember, this is the importance of the resources that we have available.
Well, this actually brings us, you all, towards the end of, and I'll let Ms. Rick say her finals as well of the actual presentation, but I wanted to provide an opportunity for you all in the chat. If you have any questions, please feel free to go ahead on and place it in the chat before we actually conclude for tonight. But Ms. Riggs, please take us away.
Okay. From our Mental Health Advisory Board, we want to thank you all for your commitment to your mental health and community well-being. Also know that stress is inevitable, but how you respond to it can be a source of strength. Once again, not weakness, but strength. It's not stress, the stress that affects us. It is our reaction to it. I love that quote. So we just want to thank you guys for coming in tonight. We are here for you. I thank God for our chair, Councilwoman Dr. Glover. She is amazing with our community. She's a godsend. So Fayetteville and surrounding areas, please don't, neglect to make yourself available to all the resources, avail yourself, to all the resources that she has presented unto us tonight. And I'm excited about our walk. You guys come out and participate, and our board is doing great things. So thank you, Dr. Glover. Back to you. And thank you guys. And I'm here for you guys, Dr. Glover, our board. We have a great board. And I'm Tracy Ricks. And if you need me, reach out. I'm in the community. And I'll see you guys at the walk. Come out.
Please come out. If you all need anything, please again reach out. You all can reach directly out to me as well if you need to reach the Mental Health Advisory Boards. Ms. Ritz is always here. She's my right hand. I thank her so much as well. She is a great asset to the Mental Health Advisory Board as well as to the city. She has a wealth of knowledge as well. Reach out to me, Niyah Glover at Fayetteville-ga.gov. And again, these resources, a lot of these resources that she highlighted tonight, you can go to our mental health advisory hub, right? So go to Fayetteville, Georgia-mentalhealthhub.org and scroll there, look into that information. And if you need any additional guidance, please feel free to actually reach out to us. We are here for you all, so please let us know if you need anything. Thank you, Ms. Selena. Thanks for joining. Reverend Selena Clark, thank you so much. I'm glad this information was helpful to you all. And if you need anything, again, we're telling you, we are here, we're visible, and we're just waiting for anything that you all need. Thank you so much for joining us tonight, and we'll see you all at our next one in 1 month. And that will be at 6 p.m. as well. So see you all then. You all see you at the mental health walk, or I'll see you at the next webinar. Have a great weekend, you all, and be safe.
Good night.
Have a good night.
Bye-bye.